of Africa in Motion. We are continuing with our presentations. Today it's tuberculosis, the one known on the name of TB. We will address 5 questions so that we can understand tuberculosis. What is tuberculosis? How is tuberculosis transmitted? How do you know that one has tuberculosis? That's a diagnosis. What are the consequences and what are the complications? How is the tuberculosis treated and how is it prevented? We will see these questions so that we can understand, have a better understanding, the minimum possible information to understand this question. The topic is broad. Since it is broad, I propose that we see this topic into 2 parts. In the first part, we are going to address the definition of tuberculosis and the way it is transmitted. We talk about the facts around the tuberculosis. Then on the part 2, we'll address the following 3 questions. We need to remember that most of times TB will affect lungs. These beautiful organs that help us to get oxygen. The organs that you find in the chest, right and left, with oxygen coming in and out. Once they are affected, we will see the complication it causes and all the impact it will cause on the affected person. Let's go to the definition. Tuberculosis is a disease. It is caused by bacterium Mycobacterium tuberculosis. It's a bacilli. This Mycobacterium tuberculosis is a bacilli. TB is transmitted mainly via airborne route. Airborne, it means just from the air, mainly. There is another mode, but this is the main one. It attacks primarily the lungs, but it can also affect other parts of the body. There is no single organ that can remain unaffected. All the parts are the same: bones, joints, brain, genitals, etc. Like here, TB had affected the brain. You can see these masses in the brain. Even the midline is shifting to the other side. You can see another one. This was a huge one with edema around, a lot of water around. This one, we call it tuberculoma. It's very painful. It is destroying the brain. You can imagine the consequences it will cause. It does affect the heart which has been normal, and with TB becomes damaged in this way. The muscle, it is already damaged. It can affect the abdomen. These are the intestines. When a surgeon operates a patient and they find that TB has damaged the intestines, this is what they will find. These intestines normally they are supposed to be free, but now here, because of inflammations, adhesions, and this small pus correction, because of pus, it is busy damaging the internal organs. It does damage the bones. A child or an adult person who has been well, and once it goes to destroy bones, it will eventually cause something like this: fractures, what we call pathological fractures. Yes, the doctor will try to treat, and orthopedic doctors together with the neurosurgeons, they will do the best to try to fix it, but you can see that already the damage has been taking place. It does affect genitals. You can see the testes of a male. Normally it is a smooth organ, very well or healthy without problem. The tubes are okay, intact, but once it starts affecting, it will destroy the genitals. The testes are damaged now. It does affect females as well. The internal organs, internal genitals of a female, they are smooth. They don't have any problems. They are okay. They function normally. But once these bacilli, the Mycobacterium tuberculosis, comes in, it does cause a lot of damages. It can come, you see the tube of the right side together with ovary, they are fine. But now look, the tube that is infected with TB. It does cause a very severe swelling, and eventually you will have pus inside. It can go and destroy even the ovary, and the complications TB can cause even infertility. We can imagine the very bad impact of TB. You see, it has a different site of location. It can even go to the vagina. It can affect the mass of the uterus. It can affect the tube. Most of times, actually, it looks like a TB likes the tubes. That's why we see this huge mass here. It does affect the ovary as well. It can affect what we call lymph nodes, which will cause TB adenitis. You see, this child had huge lymphadenopathies, even under the maxilla bone. You can see clavicular big mass. When you take a sample, you put a needle, you go to the laboratory, you find that there are bacilli of TB. Some facts around tuberculosis. It is estimated that 54 million TB deaths were registered since 2000. So it is reported that TB is the world's deadliest infectious disease. And a total of 1.5 million people died from TB in 2018, just 1 year. Then treatment coverage lags behind. The World Health Organization tells us that the treatment is not up to standard. When you check the globally how the treatment is being offered, it is only reaching at around 64%. And it should be increasing by 90. That's objective, which is very good, which everyone should support and go behind. About a quarter of the world population is infected with tuberculosis. What does it mean? Suppose we are beyond 7 billion, going towards 8 billion people worldwide. Now, a quarter of the population of the world is infected. It means almost 2 billion people have this bacteria, this bacilli of tuberculosis. Okay, not everyone is sick. What is happening is the bacilli will be in a dormant stage. The immune system, the soldiers of the body, will be able to control that infection. However, when the immune system goes down, the soldiers are dropping because of any serious condition, any serious disease, then TB will take over. That's how TB will appear. That's why we see most of times TB mainly associated with HIV at a level of 70% of cases. Globally, MDR is what we call multi-drug resistant TB. It means many drugs are not working anymore on this form of TB. These cases remains low. You see, MDR treatment success remains low, which means we take 100 people who are on treatment of MDR TB, the success rate is only 55%. Only 55 people will be treated. Other 45, it will be going to what you call XDR. It fails, or even death can come in. Only the other reason that can cause that is what we call drug toxicity. People don't respond the same way on treatment. So what's happening is it's very important to treat as soon as possible, as early as possible, and be compliant before it reaches the stage of what? MDR. When you observe now this map, the distribution of cases of this severe form of MDR, you can see what is going on. Asia and Africa. The more it is red, dark red, the more the cases. You can see some South America as well. There are many cases, but it is worse, very worse. In what? In Africa, sub-Saharan Africa. We are in a red zone, and a lot of work needs to be done. People with weakened immune system have much greater risk of falling ill from TB. We spoke about that. TB treatment saved about 58 million. This is something we should be happy about. 58 million lives were saved from 2000 to 2018. A good work is being done. Those who are working hard to save others, we thank you so much. Globally, TB incidences is falling at about 2% per year. So new cases, with the effort that is being put in place, the new cases are being minimized, which means the preventive measures are in place. The objective is now to push until at least by 2020, where we are today, we should be reaching the decrease rate of 4 to 5%. That is what objective of World Health Organization. Maybe when we collect new statistics of this 2020, we will see different result. Now, the TB is curable with a treatment. You take it for 6 months, 100% pulmonary TB, it will be treated if compliance is well observed. However, if it is a very severe one, extrapulmonary TB, or any other severe form of TB, it needs to be treated at least 9 to 24 months. We spoke about MDR. There is also what we call XDR. Then we will use more advanced treatment. TB patients usually are less infectious after 2 weeks on treatment. You have a pulmonary TB, you start treatment and you take it very well. After 2 weeks, the infection possibility of transmitting infection will be getting minimized. Let's look at this severe bacteria that is causing damages to this beautiful continent, Africa. This one, we call it Mycobacterium, tuberculosis, the one causing TB. It looks like a rod. It's a small rod. And when it does infect the human, it starts eating, destroying. It is a very hard Mycobacterium. When you see the consistency, the way it is built, that's why treatment takes long. You can see, if you observe the wall, it has many layers. It was a bacteria that was cross-cut, where you can see there are like how many layers? There are more than 5. So the medication to penetrate through and get inside and be able to destroy this bacteria, it will take a long time. They say that the cell wall is very complex. It is very thick, very difficult to penetrate. So once it comes to this beautiful organ, the lungs, it will start destroying them. Destroying the functional part of the lungs. And when I'm talking about the functional part of the lung, I'm talking about alveoli. Remember, these are the ones which help us to get oxygen. The blood comes from the heart, comes not oxygenated. It's a blood with dirty gases that we need to breathe out. Then they will come. When they reach here, alveoli will do a good job, take the dirty gases, CO2, carbon dioxide, then you breathe them out. The time you breathe in now, these vessels will be able to catch a beautiful clean air, oxygen. Then oxygen will go back to the heart so that the heart can distribute oxygen to other parts of the body. How is TB transmitted? Let's talk about transmission. Now, it is an airborne condition. Airborne bacterial infection is from a person to person. That's a main mode of transmission. It is spread rapidly, particularly in the crowded conditions. People who are in the crowded conditions, crowded area, in a small house, and there is one having TB, to cough, sneeze, and give to everyone TB. It's very simple. That's how it goes. Another way of transmitting TB is when you consume milk from animal that is infected. Okay, that's one, you call it TB bovine, from animals. So people of all ages can contract TB. It does not spare anyone, though we saw that it does affect those with low immune system. Children who are less than 5 years are the target. Older people, people with chronic conditions which lower immune system. The high risk of having tuberculosis is a group of these people having these conditions: HIV, diabetic, advanced stage, poor nutrition. The malnutrition is very bad as well. Steroid therapy, and children under 5 years. People who are under chemotherapy treatment for cancer. Those people are vulnerable to contract what? TB. This is how it goes. You sneeze in the air, the droplets will be hanging around. You might not see them with the eyes. The droplets, you might not see them with the eyes, but they will be there. Once you breathe them in, then they come in with what? With bacteria. It just, we are told that the bacteria can be hanging in the air even for more than 5 hours. Or you cough, that's another way. Then the same principle, droplets hanging in the air. Then once you breathe them in, infection comes in. You can see that it can spread easily from an infected person to the next person. If this person has now a low immune system, then it means infection will come in. Now, consuming unpasteurized milk. If this cow was infected with TB, then you take a milk, you drink it raw. There is a high risk of getting TB as well. We need to be careful because the milk is unpasteurized. When you buy it, it's good, but go and treat it accordingly. If you stay in the house without windows, it means if there is one having TB inside, you are closing bacteria inside. You are giving them more chances of multiplying and chances to infect people. So people who are building houses, please do better plans so that you prevent disease as well. Thank you for following the first part of the presentation. We will continue with the part 2. Don't miss it. It is coming very soon. Thank you very much.